Bismillahirrahmanirrahim. I'm extremely grateful to the organizers for giving me this opportunity to come and talk in front of this August gathering. The topic which was given to me was new opportunities for medical graduates. So we are going to look forward to that. In the Islamic perspective, if we look at knowledge, research, and the third one is that how you are going to help the humanity. These are the three things which are the core for the Islamic perspectives. And these are the consideration which we should be looking for our own selves as well. So in this particular presentation, I'm going to share with you that how knowledge, the research of the current literature which is available, and what you can do for your own self and you can do for your patients and for the profession. If we look over here, there are, according to Pakistan Medical and Dental Council, we have got 3,54,524 doctors and dentists which are registered with the Pakistan Medical and Dental Council, and every year if you find that there is going to be a number of them, they are going to be added, and there are going to be a number of them which are going to be deleted because of different reasons. And if we look on to the male and female ratio, the female ratio is gradually increasing, and the trend is that at current, if we look into the College of Physicians and Surgeons, around 60% of the females, they are enrolled in the residency programs. If we talk about the clinical versus non-clinical job opportunities which are available to us, the clinical roles are that we are going to be having hospitals, private practices, medical centers, and we are going to provide the specialist care to the patients as well as the teaching and non-teaching. These are the specialization you are going to be, which are in the trends, and along with that, what you need is that after doing your MBBS, you need to have residency and the fellowship or the master's or MD programs, or you are going to go for the foreign programs to equip yourself for the specialist practice. After the clinical, there are non-clinical roles as well, which the doctor can adopt. And these non-clinical roles are the roles of the healthcare management, hospital administration, policy planning, and the required skills. They are going to be a different set of skills which are going to be required than the practitioner, the specialist practice, that is organizational, leadership, and communication. And what you need for them is that you have to have masters in healthcare administration or MBA. Along with there are different programs which are available, healthcare system management. By doing those, you can adopt to the health administration. The public health careers which are available are these roles of epidemiologist, health officer, public health consultant, and the opportunities are vast. They are in the public sector as well as non-public sector, NGOs, government health projects, international organization, and you need to have MPH, that is Masters of Public Health, and MSc in Epidemiology to go and practice in these particular or acquire these jobs. The third one is the medical research and academia. The clinical research that is been there in the pharmaceutical companies, academic institutions. And when you are going to look for, you need to have job opportunities in the universities, labs, the pharmaceutical arena, and the teaching roles for the lecturing in medical colleges and research supervision. Once we are going to be there versus clinical versus non-clinical, the importance is going to be that we are going to look for our own skills, our aptitude, and the way we are going to foresee ourselves for the projection of our medical career. And these are the right fits which you are going to look for, whether you are going to have the burnout for that particular. For example, in the clinical roles, you have to have a residency. And residencies become too difficult for, especially for the females, when they are going to raise their family along with the residential programs. And I have seen that most of them, they are struggling with that. So what they can do is that they can opt for non-clinical roles, which are 8 to 2 job, and they can raise their families, and at the same time they can get benefit out of their professional achievements which they have achieved. When we talk about the jobs prospects locally and abroad, there is a local job market which is available, and if we look for that, that is public sector, the private sector, and the specialist hospitals. And if we look right now, I'm going to just give you a snapshot that if you need to work for that which job you should be taking, you are going to do a research. This is the CPSP statistical strength, which is by the November 2023, which I am sharing in front of you. If you look over there, that there are around 37,000 trainees which are present in the College of Physician Surgeons program. But there is an equal number of trainees which are present in the university programs as well. So you can well imagine that how competitive this program or these programs are going to be. And this competitiveness I am going to show you with this. This is 21st June 2024 statistics I am sharing with you, where for the 631 seats of the fellowship, there are 1,700 applicants. So there is a 1:2. So for every one post, there are 3 doctors who have done their part 1. They are competing for this particular opportunity. So they are very competitive and competitive based, and for that you need to work very hard. And as our population is growing, there is number of opportunities which are growing as well. We have to look for that, because most of us have focused onto the opportunities which are available only into the public sector. We need to look for that what are the possibilities which are available in other sectors as well, which is private sector. Similarly, if we look over here, this red line is urban population and the green is the rural population. And if we look, the green population is thicker as compared to the red urban population. And the facilities which are available, they are from the village and basic health units to the primary and the tertiary or the referral hospital. They all are, the tertiary and the secondary, they are mostly in the urban population. So there is a divide of services in the rural population, and even in different provinces, this is different. And in certain areas, you are going to find that in hundreds of kilometers, you are not going to have a single facility which are available for the healthcare delivery. The total health facilities in Pakistan, if you can look over there, that majority of them, they are in the urban population and in the tertiary care hospitals. The bed strength which is available at present, if we look around, the rural is 31% and the urban is 69%. So this means that there is a scarce deficit which is present in the rural setups. And if someone wants to have a startup, where he should be looking or focusing, urban or the rural? Because if you look right now, the cost of traveling has risen very high. One patient who is going to travel from far-flung area around the Lahore and has to come to Lahore, he is going to spend around 3,000 to 4,000 per person before he is going to reach to the tertiary care hospital. And if he is going to be accompanied by 1 or 2 per person, that is going to cost you around 10 to 15,000 rupees. And if he is going to have 2 to 3 visits which he has to make for a tertiary care hospital to get diagnosed and then treated, by the time his treatment is going to start, he has already spent around 50 to 60,000 rupees for the diagnosis of his disease. So this is the amount of the which these patients, they are going to spend. So where is going to be the opportunity? If you are going to make a startup in a village area or a rural area, there is going to be a high opportunity which will be available for you. This is the rural medical infrastructure and urban versus rural. And if you look this blue lines, that is very high. And the licensed physician per 1,000, you can identify that is very bleak and low in the rural areas. So as our population is increasing, as the need for health services that is increasing, there is an increasing need for expanding the infrastructure, the technological advances, and the diverse specialization. This further is going to open up the avenues for, once we have done the MBBS, that only specialization or the family physician, these are not going to be the two routes which you are going to take. And this has also been seen abroad as well. I'm just going to give you an insight into the jobs prospects abroad, which is in the specialist or international market. There is a growing demand of healthcare professionals globally. There is a shift from UK towards the Northern America. There is deficiency which is in the Middle East as well. There is a lot of, because Middle East is paying more, there is a shift from even the Europe, the doctors are moving, the specialists are moving toward the Middle East, and they are becoming deficient over there as well. And that is the reason that they are asking, or they are finding out the partnership with those countries which are having good infrastructure for specialist development. And Pakistan is one of them. And not only that, the fellowship programs, they are extended into the UK and Ireland, but there are more demands into the rest of the Europe as well. And similarly, there is now opportunities opening for the university programs as well. Now, once we talk of Middle East, Europe, North America, we should be looking for other areas as well. There is a huge demand which is coming up from Australia and New Zealand. Do we think that we are going to deprive of, or we should be making a brain drain to these countries? We should be making such relationship with them that it is going to be a win-win situation for both of us. Our people, they are going to have a better opportunities for trainees. Once they have done, then they can come back and they can provide services. And for that, the government should be looking into it, that once that person who has been coming back from abroad, there should be some incentive, or there should be a proper conditions that should be priming that once they come back, they are going to be taken by the system. So there is a need. We are going to look for whether we have to develop or find our market into the local perspective, international perspective, and that is going to be dependent upon that what are the ways and means. In the last 4 slides, I am going to tell you about this. The third opening which is coming up is the entrepreneurial ventures in the medical field, which is in the diagnostic clinics, emergency services, pharmacies, and medical startups. If we look into the startups, the telemedicine, healthcare apps, clinics, diagnostics, labs, most of us, we are very afraid of AI. Remember one thing, AI is going to be a tool to help us. The simulation is a tool to help us. They are not going to replace us. Yes, those doctors who are not going to adopt these, they are going to be replaced by those doctors who are going to have good skills of these tools. So it's very important that how we are going to use. If you have seen that, normally, my teachers who are sitting over here, if we have to make a presentation, we have to spend almost a week thinking on it, working on it, and developing on it. But by using these tools, it has become much easier for you, And if you are a good clinician, you are a good doctor, and you have a good understanding of the topic, you are going to be easily derive the data from the AI, validate by your own self, and you can make presentation. Same is true for when you are going to use these tools for when you are going to making a diagnosis for your patients, or you are going to treat your patients, because these tools, they have got deficiencies as well. And those deficiencies are going to be fulfilled only by the validation, and the validation is going to come from the healthcare professionals. Health IT, this is another area. The people who have been thrown by their family members into the medical profession, and they want to go into the IT, now they have got the opportunity. They can acquire the skills, software skills, and data analytical skills through the various courses, and along with the medical background and the data analysis, they can be very handy in having the health technical entrepreneurs, IT consultants, medical data analysts. And there is a huge need for that, especially when you are going to manage a big organization like tertiary care hospitals, where there is a need that these opportunities are going to open up. And if we are not going to acquire them, somebody else is going to come and acquire these positions. Medical writing and content creation is another area which is very important and very lucrative. And you can have the opportunity for freelancing as well. Most of my students, they come and they talk about that in the initial phase of their residency, it is becoming hard for them with this present economic conditions, how we are going to help ourselves and how we are going to add on what we are earning right now. These are the areas where you can have the freelancing, and you can add on to what you are earning from your residency program till you are going to be specialist and you are going to move forward. The consulting roles for doctors, this is for hospital, insurance companies, NGOs, legal firms. This already been there, and you know that what we have been thinking or talking of, that Western world is doing like that. Since the globalization of the universe, this is coming up very fast. And if we are not going to acquire these opportunities, someone else is going to take an initiative and is going to grab these opportunities, and we will be stranded. The alternate careers in non-clinical professions, there are pharmaceutical industry, where you are going to have medical device companies and insurance sectors. So you need to find opportunities over there. You should not be, and especially those who has got innovation and they didn't find that at the right time for their specialization, they can think and opt these pathways. Telemedicine, medical advice and coaching, and freelance writing, these are on the cards. Now, there are certain skill sets which you need to develop before you are going to acquire these non-professional spaces, and these are essential skills, further education, and networking. You need to work for your emerging trends, job market evolution, and the importance of adaptability. If you are going to be rigid that I am not going to take up the opportunity which are coming to me, we are going to be lost. Factors to consider when choosing a career path is work-life balance, the professional growth, the financial stability, and the personal fulfillment. So you are going to make choice out of these, that how you are going to find. There are going to be people who are going to be having their own business which is present over there, but they don't want that they should have their professional growth at the same time. That should be, they can carry forward with their business. So what they can do is, they can look for the various opportunities which are available in the pharmaceutical company. There is going to be opportunities where they are going to have the medical device companies, and at the freelance writing, that is one which is going to take their passion fulfillment. This is very important. Most of my students, when they had a failure and they come to me, and when I make an analysis, I find that they were not prepared well. And for that, you need to tailor your CV, showcase your strengths in your CV, and personalize your cover. And you need to develop leverage of references which are going to be helpful to develop yourself. You must navigate the interview process through your confidence. Preparation is the most important thing. Communication, putting yourself across. If you have not prepared it well, during the interview, you will not be able to do that. Work-life balance and burnout prevention is going to be prioritizing your self-care. Cultivate hobbies which are going to prevent the burnout, and seek support of your colleagues. The next steps of resources which you can take forward from this presentation is career counseling services, networking of the events, continuing education, and professional association. Most of them, they are sitting over here. I will request them that we must develop career counseling in our arenas. Thank you very much for your patient listening.